So this is a video on fibromyalgia. Fibromyalgia is found on page 122 of your textbook. Um, so what is it? So it's a syndrome. It's not considered a disease. It's considered a syndrome. Um, so the American College of Rheumatology calls it a syndrome that's pain widespread in 11 of 18 identified points. Um, the pain is in the muscles, in the ligaments, and soft tissue. And there's a whole bunch of other symptoms. It seems to be linked with chronic fatigue and irritable bowel syndrome. There's all kinds of overlap with all of these things. There's a school of thought that says that chronic fatigue and fibromyalgia are two sides of the same coin, that they are very intimately related. About 6 million people in the US uh, get it, and presumably about 2 or 3% of Canadians would get it as well. Uh, 90% are women. It's very much a disease of women. They don't they don't really know what causes it. They talk about risk factors, and so it says in your book risk factors include prolonged anxiety, emotional stress, trauma, rapid steroid withdrawal, hypothyroidism, viral and non-viral infections, and it's definitely involved with those unless it's not. Like it could be just no precipitating events or illness. Um, Highly fit people don't usually get it. So we don't normally see it in athletes or in people that go to the gym a lot. Um, there's really a strong correlation between anxiety, depression, fatigue, and fibromyalgia, but it's not really clear whether it's some sort of a um, a concomitant thing or whether it's a precursor. They really don't know very much. Until recently, it was even doubtful whether this was a legitimate thing. Um, doctors, there's still lots of doctors that are reluctant to diagnose it. So, one of the things that is almost universal is that there is a sleep disorder. Everybody who has fibromyalgia has sleep disorder. They don't go into stage 4 sleep. Um, so what they experience is a lack of growth hormone being released, which is released in stage 4 sleep to make minor repair, and they're fatigued. Now, is that because of the sleep, or is the sleep, is the fatigue a problem of the, the the fibromyalgia? Everybody has pain. Um, what they're looking for is high levels of um, substance P, which is a pain mediator, a neurotransmitter. Um, a lot of the medications that are currently used target this. Lyrica and things like that seem to target this. Everybody has tender points. In order to be diagnosed, you have to have tender points in all 4 quadrants of the body. You have to like, picture your body divided into 4 at your belly button, and there has to be a distribution of these tender points in all the quadrants. Um, there's an awful lot to be said, and I'm not positive about this, but there's a current theory that is uh, putting the blame squarely on aspartame. Uh, so, and my understanding is that aspartame was originally developed as a neurotoxin, as a chemical weapon. So, Who knows? Um, but that seems to be a big part of the problem. So um, there is impaired muscle function. There's pain. Um, so they look at it and they say, okay, so what's gone off? The uh, there's a couple of control mechanisms. There's the hormonal, the endocrine, which is really the hypothalamus, the pituitary, the adrenal glands. Uh, there's autonomic nervous system impairment seems to be implicated. People are quite worried that. Um, Hormonal, reproductive hormonal access, the fact that it's 90% women makes them suspect that it might be estrogen or progesterone. Um, or it could be an immune system thing. And that's why it's kind of stuck in this section. It tends to fall under the auspices of rheumatologists, which are immune specialists. So, for lack of any place else to put it, that's why it's lumped in with these diseases. So, uh, this is some of the tender points. So the knees, the elbows, the at the second rib, lower cervicals, occipital traps, supraspinatus gluteals, and the greater trochanter. And you need to have 11 identified spots, uh, and they've got to be in all the quadrants. So if there's nothing in the right lower limb, gluteal, trochanter, or knee, then you won't get diagnosed as fibromyalgia. And that's kind of where they draw the line in the sand. And these tender spots are not trigger points. This is not myofascial pain. This is tender points. So uh, widespread pain, it shifts. Deep achy pain, just tingly. There's muscles get stiff. They're just the tender points are all over the body. Poor stamina, fatigue, low pain tolerance, and sensitivity amplification seems to be part of this. Now, you will see a lot of people with this because a lot of people with fibromyalgia are at their wits' end. They end up seeing chiros and massage therapists all for symptom relief, and so you will see an awful lot of it in more than 2% of your practice. So it's not a representative sample. Um, the um, the clinical manifest or the diagnosis, I'm sorry, is made by these tender points. But the problem is, like, is it mononucleosis? Is it chronic fatigue? Is it like there's a lot of similar issues. So the pain has to be existent for more than 3 months. You need 11 of the 18 points. Uh, they have to be distributed. You have to persistent fatigue, and you have to have non-refreshing sleep. Um, so, and really, those are fairly easy criteria to hit. So, the diagnosis is gone way up. Uh, it is in fact the most common uh, musculoskeletal diagnosis going now, whereas even 10 years ago, doctors were very reluctant. Now it's diagnosed more than rheumatoid arthritis. So these people, this is a chronic and it's a debilitating disease, and these people get depressed with it. Uh, Employers and peers at work get sick of hearing about it. They get so there. It tends to have this social problem. It stops you from doing things that you want to do. So it makes people really depressed. Um, the It's kind of a vicious circle because it's exacerbated by stress, but it's stressful to have it. So I don't know. Uh, it's different than other musculoskeletal pains is in that that too much physical activity, overstretching, really really hurt these people. So does sudden change in barometric pressure. Like if it goes from a high to low pressure, and the more sudden, the more there seems to be a problem. So, um, yeah, these uh, these people have trouble. It's saying during exercise, when circulation should normally increase to muscle and brain, in fibromyalgia, the opposite happens, and circulation is decreased significantly. Um, so these people can have lots of problems. They Another problem is they can have difficulty in breathing because the diaphragm uh, starts to fatigue and becomes a problem. Um, so what they'll do is they will compensate by breathing with their ribs and the secondary breathing muscles, and they can end up with tender points in there. Um, so uh, yeah, these people have trouble with just day to day life, like walking to the mailbox or cooking or cleaning, just normal stuff. It can be challenging when it's bad. Uh, so uh, there's just management of this. Um, there's no real treatment that seems to work. There's some of these treatments seem to lessen symptoms, but it doesn't seem to get rid of anything. It doesn't cure. So really, education is the biggest part of it. It's like when these people understand what it is, and a lot of it is counterintuitive, but a lot the things that exacerbate their symptoms need to be avoided. They need to really be very careful about nutrition, sleep, exercise, and stress management. Stress management is probably the biggest thing, and it's so difficult when you're debilitated from normal activities to manage your stress. The various pharmacological things, really, the antidepressants, the tricyclic antidepressants, are the ones that I see the most in practice. I've had patients that have really benefited from cognitive behavioral therapy, where it's about doing things to minimize stress. Massage, it's been my experience that every fibromyalgia patient that I've ever seen has gone across the hall and had massage, and they swear by massage. But you don't treat like trigger points. You don't work out those tender points. Uh, I mean, I'm sure that in in your practical classes you will learn a lot of treatment for this. Avoid ice and avoid overdoing it. Don't work on one area of the body for too long, and don't do too many massages in a row. So that's it for fibromyalgia.